Thank you to everyone who joined our TikTok live today. I'm Dr. Sabrina Haq. I'm an endocrinologist. One thing that really worries me is borderline diabetes, because borderline diabetes or pre-diabetes is gives the impression, even the name actually gives us the impression that it's not that big of a deal. It's not at the level of diabetes yet. I just have to be careful because the number on the blood sugar report looks high and that's it. But unfortunately, even before borderline diabetes, which is called pre-diabetes or insulin resistance, we start seeing damage at the level of our organ system. So the organ that produces our own insulin starts getting damaged even at the level of insulin resistance. And this is something that's really scary, and this is something that should be preventable, because as a society as a whole, we have the tools to now diagnose insulin resistance. We now have the tools to pick up high blood sugars at its earliest form. And we're living longer and longer, but are we really living healthier? And the unfortunate thing is, even before borderline diabetes, or actually at the level of borderline diabetes, we're at risk of all the microvascular complications, or at the small vessel damage. And these small vessel damage leads to things like eye changes, leads to things like kidney changes and nerve changes. One of the things that I see very commonly in my practice is nerve pain, which is due to borderline diabetes, because the patients have been seeing neurologists and there's no other reason for the nerve damage. So if you've been told that you have borderline diabetes and you're being told just to wait and watch, don't do that. Please advocate for your health. Take it seriously, because chances are you've probably had underlying organ damage for several years. And borderline diabetes is the stage to take it seriously. Ideally, you would have been tested to look for insulin resistance. Some signs of insulin resistance are things like darkening of the skin fold of your neck, putting on weight in the middle of your body, in the tummy section, having darkening in the underarms, having skin tags or little bits of skin sticking out from your neck folds, and on your blood tests, a fasting glucose and a fasting insulin. Your fasting triglyceride, which is seen on the cholesterol panel, would also indicate borderline diabetes. It would also indicate defective glucose metabolism. So if you have borderline diabetes and you're just waiting and watching it, it's not enough. Please advocate for your health care. If you have borderline diabetes, please make sure you take it seriously. Even if you choose not to take medications, please keep an eye on your blood tests in 3 months or in 6 months. And this is to give you really excellent quality of life later on down the road.